Hey y'all, just wanted to make a quick video just so we could go over a few things. And I know you know me, but Sharma, hi, I'm Cindy Bailey. I'm the LPN Med-Surg instructor. Just a few things. I know y'all both had clinicals yesterday, so y'all may know more about all this than I do at this point. But just wanted to talk to you about your students and what is expected of them. I've told all groups to meet y'all at 6:45 in front of Starbucks at Erlanger, and then I told them wrong for Gordon, but then I will correct it this afternoon with them. So they will be meeting you, Oman, at the east entrance where we talked about. They are expected to be there 6:45 to 7 o'clock or close to it. I always do, especially the first day, do a pre-conference. On days after that, I may not do as much of a pre-conference. I'll just make sure everybody's there, and then we'll do a longer post-conference. Post-conference, they're more than welcome to tell you what they did that day if they did anything interesting. I also have been known to go into the computer and find labs or medications that they gave throughout the day and talk about those, because I know that usually the nurses don't have time to talk about them. And of course, that's what they lack knowledge on all of our exams, plus on the NCLEX, is labs and medications. So the more they get it, the better. Lunch, they get 30 minutes. Oman asked me about this yesterday, but they just have to all be off the floor. At Erlanger, it's probably a little bit easier because their cafeteria is open. Gordon, I know their cafeteria is not open yet because of COVID. So I just told them as long as they meet me back wherever I designated by whatever time I designated, it was fine. I didn't care if they stayed together, separated, whatever. Just as long as we were all back at the same time and everybody was off the floor. As far as procedures go, if their patients are going down for a procedure or anybody else, please send them down there. I had a group last semester thought I wasn't going to let them go see procedures, so several of them missed seeing heart caths that they could have really learned something from. As far as LPN versus RN, what they can and can't do in the hospital, pretty much the only thing LPNs can't do is hang blood by themselves, but nobody hangs blood by themselves anymore. And they can't be the lead nurse on hanging blood. They can be the person that backs them up and checks off with them, but they can't be the lead person. They also, in some facilities, can't do IV push medications, and some they can. They just have to figure out what's okay in their clinical setting. I told them where to park. I told them meeting you if they are absent for whatever reason. If they email me first, I will tell them to email you too, or if they call me, whichever one, I'll tell them to email you or call you if you've given them your cell phone number. You don't have to give them your cell phone number. You can if you want to. It's totally up to you. As far as care plans, they are going to be due on June 20th and July 11th. And then they're due by 11:59 that night. If they are late, we count off points. I usually count it off, it's according to how late they were. If they were less than an hour, I'd probably count off 1 point. If they were 24 hours late, I'd count off 5 points. They must make 75 on that care plan to pass it. If they don't, then they'll have to do a rewrite, and it will be due the following Sunday at 11:59. But remember, those can only score if they do a rewrite. The most they can make is 75, because it's not very fair if everybody else turned it in and then they got an extra week and still made an 80 or 85, whatever on it. That's why we do that. That is the only 2 assignments that y'all will have to grade. I know they said there's a lab card assignment, but that's for me to grade. All that is these units that have a lot of medications and a lot of labs, I get them to make med cards, just trying to get them to keep it in their memory. As far as care plans, I have all that in Georgia View. If you can't access it, I know Sharma, you talked to me about it. If you need my help, I'll be happy to help you. Just let me know. As far as care plans, they do have to turn in this assessment form with the care plan. And this should be a head-to-toe assessment that they're doing. They shouldn't just be going in and getting the nurse's notes of what the assessment was. They really need to become very familiar with doing head-to-toe assessments. As far as the care plan packet, you have the demographics, pathophysiology, medical diagnosis, all that stuff. On medical history, if they have 50 million things in there, I usually tell my students to go back and pick just the stuff that pertains, that will affect what's going on now. So, for example, sorry, I'm turning off my heater. For example, if they are there for COPD exacerbation, but they had, I don't know, a broken arm fixation 20 years ago, I don't care. So just tell so if that's the case, just tell your students to go back in and figure out what just pertains to what's going on now. Discharge planning, they will just make 6 bullet points of stuff that is important for discharge. And this will not be something, I'm assuming, at least not at Gordon, won't be in their computer system. The students are going to have to use their critical thinking skills to figure that out. Medications, it's totally up to you. I usually tell my students I want at least 10 medications on there. If they gave 10 medications that day, 10 or more medications that day, they are more than welcome to just use the medications they gave. If they did not, then they need to go into use some of the ones that have either been discontinued or PRNs or whatever. Patient response on that, y'all may tell them something different, but I tell them patient response is how the patient did after that medication. So if it's a blood pressure medication, I would make them, especially if it's one that's for high blood pressure at that time, acute high blood pressure, I tell them give me the pre-blood pressure and the post-blood pressure. If it's insulin, same thing, give me the pre and post blood sugar levels. If it's an antibiotic, give me the when they first came in, and it may not be that day's white blood cell count, but a relatively new white blood cell count to see if the medication is being helpful with the bacteria. Lab and diagnostic tests, very similar. Significance to patient, what it tells you about the patient. Imaging studies, the same thing. Your nursing diagnoses, they have to have 3 nursing diagnoses. They have to have etiology, has to be different for all 3 of them. Goals have to be measurable during their 12-hour shift. So patient will ambulate by the end of my 12-hour shift, and they have to say met or not met in the outcome, and they have to say why it's met or not met. On the nursing interventions, we want meaty nursing interventions, not just vital signs every 4 hours. I want to know exactly what vital sign you're looking for. If the patient has, I don't know, poor, I don't remember exactly how it's worded, breathing technique, whatever your nursing diagnosis is, it needs to be stuff that matches that diagnosis exactly. And the rationales can come from their book. I tell them that I want most of their stuff to come from their book, but if they have to dig into a website, just make sure it's a reputable website. Subjective and objective, just what the patient said. If it's a patient that is nonverbal or comatose or whatever, sometimes I'm more forgiving on the subjective data, but I definitely want good objective data. They also need to make sure there's a reference page at the end of this. This needs to be in APA format, and before these care plans are due, I will make sure that I post something from Amy Berger, who's one of the librarians, who sent me some really good information about APA format. And I know Sylvia does one, so they still should have that stuff from last semester as well. As far as uniform, they should be in their whatever those light blue uniforms are. They should have a watch on them. Some of my students last semester hated to wear a watch on their wrist, so they bought one of those little, I don't know, one of those little watches or one of those little clocks that attaches to their name tag. I was fine with that as long as they had something with a second hand on them, just in case the clock in the room didn't work. No piercings at all. Rings, they can only wear their wedding band, and it has to be just a solid band. It can't have any diamonds in it because, of course, that can hold some germs. White socks, white shoes. Now, they can have like tie-up tennis shoes and have a little color on like the Nike symbol or whatever, but it needs to be mostly white tennis shoes, and they need to be clean white tennis shoes. Hair has to be pulled back. I tell the girls that it can be in a ponytail, and that's fine, but if you have really long hair, you may want to think about that, because if you have that hair up in a ponytail and then your hair comes over and it ends up down in poop, blood, whatever, that you're not going home, or you'll lose clinical hours. So I make them think they may want to get it up in either a bun or braid, whatever, just to get it out of their way. That's pretty much all on how they look. I make sure they don't have any cell phones. They will, if they have their cell phones, they're more likely to decide to pull them out when you're not looking. And I did have a clinical instructor complain about one of the students that did that. She would go off in a corner and end up using her cell phone. So I just made it to where they're not allowed to have their cell phones on them at all. They are allowed to carry their books or whatever with them, but unless their nurse has absolutely nothing for them to do and they have cleaned everything and done everything